All right, so thanks again for joining us for Colorado Paid Sick and Safe Time. Lucky for all of you, the team at Simply HR and every other HR professional and employment attorney and payroll company has had the practice of almost 1 year of paid sick and safe time for the employers with over 100 employees. So we've been practicing paid sick and safe time for a while now, and I think we have worked out most of the confusion and any possible issues. So now you get to learn the more refined version for your teams. So just to kind of recap and level set here, on July of 2020, Colorado legislation passed Healthy Families and Workplaces Act. That included 3 pieces of paid time off. One of those elements has expired. It expired at the end of 2020. One of those elements includes the public health emergency leave, which, if any of you are still curious, it is still in effect. Public health emergency leave will be in effect through the duration of a state or federally declared public health emergency, and for 4 weeks after the end of that public health emergency. While Colorado's ended in July, the federal public health emergency is still in effect. So we do still have public health emergency leave, which is a whole other topic, and we won't be spending much time, if any, on it. But feel free to reach out if you do have questions about that particular one. So what we will be chatting about today is a requirement for employers to provide paid sick and safe time to their employees. So what this requires is that every employer provides 1 hour of paid sick and safe time for every hour worked. You can also think of this in an incremental sort of accrual, which is 0.0333 hours of paid sick and safe time for each 1 hour worked. The time can be accrued or it can be front loaded. So those are 2 terms that HR and payroll use often. And in other words, accrual is, again, you're kind of building those hours of paid sick and safe time as the employee's working. Front loaded would be if you have your employees start work, so on their day of hire, or maybe on each calendar year, you front load their banks of available time to say, okay, it's, you've just been hired, or it's the beginning of the calendar year. We're going to give you all of this paid sick and safe time all at once so that you have the ability to use it over the course of the year. As I mentioned, we have already been playing with paid sick and safe time for those employers with 16 or more employees. That was a requirement at the beginning of this calendar year in January of 2021. So now I'm guessing most of you who are on the call have fewer than 16 employees, and this will be required of you beginning in January of 2022, which is crazy enough, just around the corner. With this, we are often asked who gets paid sick and safe time. Is it just full-time employees? Is it just employees after their 90th day of employment? Because that was a common practice for paid time off. So this law says that all employees have to be eligible to begin at least accruing and to be able to use the hours that have accrued as soon as they are hired. And yes, it means all employees. If you have independent contractors, in theory, if they are genuinely independent contractors, they should not receive any benefits. So no independent contractors are covered, only employees are covered. And there are so many categories of employees who it seems wouldn't be covered, but they genuinely are all covered under this particular leave law. So we've been asked about substitute teachers or people who work on an on-call basis. In theory, they would never be able to use the hours because they're only coming in when they're on call. We've also been asked about seasonal employees, employees who are there for just a very short duration. The law does not carve out any exceptions. So paid sick and safe time does have to be provided to all employees, regardless of their status, the expected duration of their work there. And so that again begins of the date of hire through the season. Something else to note is that if an employee leaves and then comes back within 6 months, whatever paid sick and safe time they had left in their banks as unused, that paid sick and safe time has to be reinstated. So it has to be given back to them when they return, if that return window is within 6 months, so that they can use it. Okay. Everyone's on board now so far. Again, holler if you have questions. I'm keeping an eye on the chat for those of you who jumped in a little bit later. So please feel free to ask questions as we go. Okay. So as far as limiting the amount of time that employees are provided, you can cap the amount of time that employees can use. So you can cap the time at 48 hours per year. So for a full-time employee, that's about 6 days. A cap can be 48 hours for a standalone paid sick and safe time policy. If you are treating this as general PTO, then the cap is a little bit different. So I'll get into this in a little more detail later. But for PTO and vacation, Colorado laws say that the cap has to be at least 1 time the annual allotment or the amount that somebody can accrue annually. So it is a little bit different. When we talk about paid sick time, we want you to genuinely use the time for only sick and safe time purposes. The reason for that is for sick and safe time, there's a really restrictive nature around the use that somebody can use that time. And so because of that restrictive nature of use, we are allowed to have some more rules and limitations around it. Once you start getting a little more flexible and calling it paid time off, paid sick time, paid time off or vacation, even if you still call it paid sick, but you allow employees to use it for vacation purposes, it's technically PTO. And when we get into PTO, the state says that any vacation or PTO is defined as wages. And so what makes this different is once somebody has earned and accrued and vested wages, then they are due and payable to employees at the time of separation. So there is a huge difference between paid sick and safe time policies and general PTO policies. And again, I'll chat a little bit more about that as we get farther into this presentation. So another question we receive often is, does the unused paid sick and safe time have to carry over each year? So if you use the accrual method, so again, if you're giving 1 hour of paid sick and safe time for every 30 hours worked, or if you're giving 0.0333 hours for each hour worked, then you have to carry over paid sick and safe time from year to year. Again, you can implement that use cap of 48 hours. So although somebody is going to continue to have that time available, you can still limit their use to 48 hours. I know it's a little contradictory. If you use the front loading method, you do not have to carry over paid sick and safe time at the end of the year, because at the beginning of the next calendar year, you're going to give employees another 48 hours of available time in their buckets. So time goes away from last year and they'll get new time to use for the following calendar year. Okay, everyone with me still? Okay, so Colorado sick time law is a little bit different and a little more generous than many state sick time requirements. However, we are seeing several states incorporate safe time too. So when we talk about the sick time part of this, these are typical traditional reasons for sick time. So mental or physical illness, injury, or health condition for the employee or the employee's immediate family member. And there is a definition for family member. This also covers medical diagnosis, care, treatment related to an employee or family member's illness, injury, or condition. So if somebody has to go to doctor's offices for care or treatment, that would all be covered. And it also covers preventative medical care. So if you have an annual dentist appointment or something like that, then you can use it for that. Sorry, I just realized we had a question come in that I didn't notice. So quickly to go back, if paid sick and safe time is accrued and time is carried over, it can be capped so they never have more than 48 hours accrued. Correct. You can implement a usage and accrual cap of 48 hours if you're using the accrual method. Good question. Thank you so much for adding that so I could help clarify. Okay, so then we look at covered uses. We have the additional uses for safe time. So if an employee or family member is a victim of domestic abuse, sexual assault, or harassment, employees can use leave for the following safe time purposes in addition to sick time. So the reasons allowed for this are seeking medical attention to recover from a mental or physical illness, injury, or health condition caused by that said domestic abuse, sexual assault, or harassment, obtaining services from victim services, obtaining mental health or other counseling, or seeking relocation due to those said concerns. And then also seeking legal service or preparing for criminal proceedings, court proceedings, things like that related to that domestic abuse, sexual assault, or harassment. So as you can see, Colorado's paid sick and safe time is more broad than a lot of other states' sick time or safe time requirements. Okay. I'm going to pause here for just a second to see if there are any questions that come in. All right, so when we talk about vacation time or paid time off, oftentimes employers say that you as the employee can only take time off in certain hourly increments. So maybe I as the employer don't care to track time off unless you're taking a half day or more off. That is completely allowable if we're only talking about vacation or paid time off. However, when we talk about paid sick and safe time, the law says that you have to allow employees to use this in 1 hour increments if they are wanting to use that time off. So in other words, if somebody wants to go to a dentist appointment first thing in the morning and they're going to be back at work by the time an hour is up, or they have been out of the office for an hour, you have to allow them to use that in a 1 hour increment. We can't say, if you're going to take a dentist appointment, go ahead, take half the day off. I'll process your paid sick and safe time when it gets to an hour. So they have to be able to use that time in hourly increments. Oftentimes this one is pretty confusing for employers depending on how your employers are structured. So the question is, at what rate do I pay sick and safe time? So the rules say that you have to pay leave at the same rate or salary and with the same benefits as the employee normally earns during their hours worked. If they would have normally received overtime or bonuses, you do not have to include that in that regular rate or salary. Where it gets confusing is if employees have commission employees, or if you have someone who doesn't work on a flat hourly rate, or maybe you have somebody with tip credits. So for someone who is commission only, you would pay them at the applicable minimum wage. So this year it's $12.32. I'm pretty sure $12.32 is our minimum wage for commission only employees. However, if you have a blend of base salary plus commission, you have to calculate their ordinarily received regular rate of pay, and that is the rate that they have to be paid out at sick and safe time. If you have employees who are paid with a tip credit, so they're paid slightly less than regular minimum wage, and you make up the difference with a tip credit, those employees have to be paid at the employee's regular rate, which is at least minimum wage. So you're adding in a supplemental amount to get them to at least full minimum wage. For employees with non-hourly pay, the leave has to be paid at the employee's regular rate, and you would look at, good question. So we are going to look at the 14 days the employer worked prior to the qualifying leave. So you're going to look at the 2 weeks before the qualifying leave and calculate the employee's regular hourly rate for those hours. And that is the amount you pay out for paid sick and safe time for the qualifying leave. Great question. All right. The commission part is tricky, especially if somebody is blended with a base hourly wage or salary plus commission. And I realize for commission only employees, they may be receiving significantly less if they're only paid minimum wage. I don't make the rules, we're just sharing them with you. Okay. So moving on, do we have to pay out unused paid sick and safe time when employment ends? Like everything else in human resources, it depends. So if you have a standalone paid sick and safe time policy, then no, you do not have to pay out any remaining paid sick and safe time from somebody's bank when they separate from employment. If you've combined paid sick and safe time with PTO or vacation, or even if your policy says it's just paid sick and safe time, but you're treating it as PTO, then yes, you do have to pay out any remaining unused paid sick and safe time or PTO when employment ends. Okay. So there are a lot of different implications to how you title and treat this time. So we do have a lot of employers consider if they want to keep paid sick and safe time separate, or if they want to include paid sick and safe time to their existing PTO policies. I'm going to just talk about some general concepts first before I go into these technical aspects of it. So when we consider keeping PTO as one all-inclusive bucket and allowing employees to use it for paid sick and safe time, for PTO, all of those things, the pros to that are that it's slightly less administrative work. I would guess that the bookkeepers, accountants on the call would be nodding their heads here. The less buckets of time you have, the less administrative work it tends to be. However, there are lots of great payroll systems and accountants and bookkeepers who have great systems that make it relatively easy. So that's one advantage. Another advantage of combining paid sick and safe time and paid time off is lots of employees see this as an advantage. They can use this big bucket of time for whatever they would like to do. And for those of us with little kids who get sick sometimes, and we just kind of have to take time off to take care of little kids. Or if you have any caregiving responsibilities, or if you are a person who tends to use your sick time, other employees sometimes, if they don't use sick time, can build some animosity or resentment. I know it sounds awful, but we see it all the time, towards employees who are using their paid sick and safe time if they don't feel like they have access to the same amount of time. So by providing a general bucket of time, like paid time off, to say, if you have sick kids, you can use it for your sick kids. If you are excited about the beautiful powder days up ahead and want to use them to go skiing or boarding, you can use that time in that way. Either way, you all get the same amount of time. Oftentimes, we sort of see that as a well-received message in workplaces. The disadvantages to combining things are that you have to pay out any remaining unused PTO at the end of employment. So that is a financial risk to some organizations that we're just not able financially to take. And that's totally understandable. I think the other disadvantage that we see when employers separate the time, sorry, I had to think about that one really quickly. When employers separate the time and we either have paid time off and paid sick and safe time separate, or maybe you don't have paid time off at all, which is completely allowable. Maybe you just have paid sick and safe time. We do see employees sometimes lie because they want to use those hours that they believe should be available for them. So in that particular scenario, if an employee would have had access to paid time off, they may have told you in advance if they plan to go skiing or snowboarding on some day. But if it's just sick and safe time, and they are the type of person who is going to be less than truthful about how they're using their time, they're likely not going to tell you in advance. They're just going to tell you that morning so that they can use their sick time for a good powder day. And I, of course, want to believe wholeheartedly that all of your employees would never lie to you. And I hope that those scenarios don't apply to your particular workforce. But I can say that after 8 years or so of HR consulting, as well as many more years of being an HR generalist, we tend to see employees lie from time to time. So that's the reality of the situation. Okay, so then to get into the technical pieces of adding paid sick and safe time to PTO. So again, yes, you can include paid sick and safe time in your existing PTO policy if you have one, or if you want to create it this way. It has to incorporate all of the requirements of paid sick and safe time. So that means it has to have the accrual cap or be more generous than that. It has to be allowed to carry over if you're using the accrual method. You have to allow the employees to use it for all the reasons that paid sick and safe time say. It also has to be clear in writing that the policy is sufficient to satisfy the Healthy Families and Workplaces Act. It doesn't have any more strict rules, and additional leave is not going to be provided or may not be provided if the employee uses all of their time for non-sick and safe time reasons. So in other words, you're telling your employee that if you chose to take vacation with all of your time, when you have a qualifying paid sick and safe time reason, we are maybe not going to give you additional time. This is all you get. use it wisely. The only exceptions to that are during a qualified public health emergency leave, which again, we are in now because there is a federally declared public health emergency. And in that case, just very quickly, during the period of a public health emergency, somebody is entitled to up to 2 weeks of time off, which is relative to how many hours they work in those 2 weeks. So a full-time employee gets 80 hours. A part-time employee gets 2 times what they normally work in a week. So they will get 2 weeks of paid time off for qualifying reasons related to the public health emergency. And if they don't have any paid sick and safe time or PTO, you may have to supplement their hours so that they do get a full 2 weeks for that public health emergency related leave. Okay. It's a little complicated right now between PTO and vacation and paid sick and safe time. And then we had this little tiny pandemic show up. So that of course is complicating things too. All right. So as I mentioned, we've been practicing this for a year now with the larger employers. So here are some hangups that we have run into. So some possible hangups. Employers may not want to front load paid time off. So in other words, if you are providing paid sick and safe time and PTO in the same bucket, you might not want to front load that time, which is absolutely fair because if they separate, you're going to have the financial liability of paying out the remainder. If you use the accrual system, vacation and PTO rules say that it must be provided over proportional increments. So to go back to the accrual rate that's required, 1 hour for every 30 hours worked, or 0.0333 hours per hour worked. If you were to use that same accrual rate over the course of an entire year for a full-time employee, they could actually accrue up to about 70 hours. Thankfully, paid sick and safe time says that once they get to 48 hours, we can stop that. However, if you're calling it vacation or PTO, we have to use incremental numbers over the course of an entire year. And whether that's hourly increments, weekly, monthly, semi-annually, you can choose. But again, you have to satisfy the requirements of both paid sick and safe time and vacation and PTO if you're going to combine these two policies. The way that we've seen this work best is when employers are either able and willing to front load 48 hours of PTO at the beginning of employment and every year, and they are comfortable with taking that financial risk. If somebody leaves mid-year, they're going to have to pay out anything that's remaining. So that's one way that we've seen it work well. Or if an employer is willing and able to accrue up to 70 or more hours per year for full-time employees. If you are not able to commit to either of those, I would very highly recommend separating your paid time off and your paid sick and safe time policy, or just providing paid sick and safe time and being strict about how employees are able to use the time. So if you combine, so we had a good question come in. So if you combine paid time off and paid sick and safe time, the accrual cap changes a bit because paid sick and safe time says, yes, you can cap accrual at 48 hours. Vacation and PTO rules in the state of Colorado say that you can have a cap, but if you are accruing time it has to accrue proportionally over the course of the year. So then when we look at the accrual rate required of paid sick and safe time, the accrual rate is 0.0333 hours per hour worked. If you take that accrual rate proportionally over somebody's 2,080 possible full-time hours in a year, that person could get up to 70 hours of PTO in 1 year. So because we're trying to fit the two together, we have to comply with the rules of both. And when they contradict each other, we have to use the more employee generous rule. And I know that one is really confusing. We have spent, I kid you not, hours of time digging through statutes and hashing this particular topic out. So I feel grateful in that when you are getting this version, we can feel very confident in saying, we've gone through, I think, every possible scenario, and we're giving you the abbreviated shortcut version. So yes, that is because it's accrued. If you, to go back to this scenario again, if you decided to front load 48 hours, you could front load 48 hours. You can cap the time and the use at 48 hours. You do run the risk of having somebody receive all 8 hours of day one of employment. And if they quit in the first week, if you called it PTO, you would have to pay out all of that 48 hours at their regular rate. So big decisions to make if you do want to provide PTO and paid sick and safe time. So again, the way we've seen this work best are really just 3 options, I'd say. If you're able and willing to front load 48 hours of PTO at the beginning of employment, again, risky because you could have to pay it out, or you accrue at the minimum paid sick and safe time hourly rate, and that time accrues over the course of the entire year, because that's what PTO and vacation rules say. And that person's going to get, if it's a full-time employee, they're going to get to almost 70 hours over the course of the year. So you have to be okay with that. If you don't like either of those options, you can absolutely separate and provide paid sick and safe time, which is required in accrual or front loaded, but you don't have to pay it out upon separation. And if you want to, you could also provide a separate paid time off or vacation bucket of hours that somebody has access to. Really, you can be much more flexible in how much time you want to provide to someone. You can provide 0, you can provide as much as you want. There are a couple of parameters around it, but much more flexible. And then have them as 2 separate buckets. I know that part's really confusing. Does anyone have any other questions about the possibility of combining hours in paid sick and safe time and PTO? Okay. Again, you know where to find us. You can absolutely reach out afterwards if you think about this and you're like, wait a minute, I want to go back. Go backs are allowed. And then quick go back to, if a Colorado employer has remote workers in another state, then those employees may be covered by a sick or safe time law in that particular state. It's always based on where the employee is working. So they may not be covered by, they will not be covered by our sick and safe time. They may have a different sick leave law that applies. And if you have employees in different locations, I would look at both the state to see if they're covered by a state law, or many cities also have their own paid sick and safe time rules. For example, the state of California has paid sick leave, but pretty much every major city in California has a much more generous and strict paid sick time law. Also, I think Austin, Texas has its own. The state of Pennsylvania, I don't believe, has a statewide paid sick time policy requirement, but I think some cities in Pennsylvania may have their own. It's definitely worth digging into and making sure that you're being compliant with both the state and the city or jurisdictions. And Arizona, ooh, good question. Nevada has like vacation rules. Arizona may have paid sick time. We believe it does. I can maybe circle back to that one. I know where to find you. So I'll go back to that. Holler if you have questions on specific states, and we'll be happy to give you some rough guidelines there. And of course, it's always changing too. So posting requirements. This is the current comps poster. Hopefully all of you have state and federal wage and hour employment law posters in your workplaces. This is the most current version. And if you don't have this particular poster, you can print it from colorado.gov on the posters page. And if you haven't looked at it, I know that as an HR nerd, I probably think this is more exciting than the average person. However, if you're running a business in the state of Colorado, this is a pretty quick and easy read, and they've broken it out to be really, I think, easy to understand. So I would highly recommend actually reading this document. If you need some extra resources to help sleep better as you're going to bed, this might put you to sleep. But I think it's a pretty good resource that Colorado has put together for us. So the requirement is that this is posted with your posters in your workplace. And if you provide a handbook or a manual, this should be provided with that handbook also. And for the last couple of years, Colorado has updated this specific document each year. Usually comes out in late January or February, though. Of course, they can be a little late when they roll out documents. So I would take a peek at that on colorado.gov if you do not have it already. Okay, does the employee have to give advance notice? Employers have to allow employees to use the time upon request. However, when the leave is foreseeable, we can ask our employees to make a good faith effort to provide notice in advance. If you have to have a doctor's appointment, obviously it's easy to send in that request in advance. But if somebody gets sick, if somebody is assaulted, they're not planning on that, and they might need time off immediately, and we're required to be flexible with that. Another really common question is, can we request doctor's notes from the employees? Of course, it depends. So for leave that is longer than 4 or more consecutive work days that the employee is scheduled to work, the employer can request reasonable documentation that the employee use the time for a covered purpose. You can't ask the employee to disclose any specific details relating to their sick or safe time as a condition of providing the leave. So as far as reasonable documentation, we can ask if the employee has received services from a provider, if the provider is able to provide a document indicating that it is qualifying leave, or if it has a qualifying purpose. If they didn't receive provider services or can't get a provider document without added expense, the law says that they can provide in their own writing that the leave was for a sick and safe time purpose. They can also provide things like legal documents indicating the safety need. And you cannot require that employees provide documents that have signatures or be notarized. The documentation has to be any reasonable method, including electronic. So it really broadens the allowable documentation around this. All right, so what records do we have to keep and how long do we have to keep them? So this says that for a 2-year period, we have to retain those records for each employee, documenting hours worked, paid sick leave accrued, paid sick leave used, and you'd want to keep any documentation related to that. As far as storing documents and personnel files, we just want to remind you to always keep medical files separate from their regular personnel file. I'd say this applies more with a much larger organization. A huge reason for this is if you have a manager filling out somebody's annual review, you want them to be looking at performance-related documents, their job description, any coachings, corrective action, things like that. They absolutely do not need to see, and they shouldn't see, somebody's I-9, and they also should not see any medical related documents. So that's the reason those categories of documents should be stored separately from the employee's regular personnel file. And that is true whether this is a printed giant file cabinet in your office, or if you store files electronically. I know a lot of payroll companies have electronic file storage for employees, or a lot of people use things like Dropbox or Google Drive. Any of those are allowable as long as you have some security measures around them and you can limit access. So managers should not have access to the medical files or I-9s. That should be reserved for just a need to know basis, like owners possibly, or HR possibly, if you have those functions. Okay. Of course, everyone wants to know the penalties. Like, okay, this is fine, but actually, what if I don't want to do it? So according to Colorado General Assembly, an employer found in violation is liable to the employee for back pay and other equitable damages. Also, I would assume that the word will be out on the street that every employee in the state of Colorado should have access to paid sick and safe time. So sometimes there's some really obscure benefits that we don't really know about. For example, jury duty. The law has some required benefits or paid time off for jury duty, but how often does anyone actually have jury duty? Not very frequently, so I think it's easier for employees to not know their rights on that particular topic. However, pretty much everybody's going to get sick at some point, or they're going to have some caretaking responsibilities, so that they have to provide care and take sick time. So I would guess that every employee in the state is going to be aware of this pretty quickly, and it will quickly become a known expectation of all employers. Okay. Fun stuff, right? This is the stuff nobody tells you when you're like, I'm going to start a business. It's going to be great. We appreciate you though. We see how hard you're working. Next month, we're going to be talking about giving and receiving feedback. So a much less technical topic, sort of, but we've had so many employers just tell us that this is a really, really difficult topic for them. And we want to hopefully take away some of the negative stigma around giving and receiving feedback and help you think of ways to make this a more regular practice in your workplace so that it's not so uncomfortable and it is a productive, useful, and hopefully somewhat welcome tool in your workplace. So we'll be doing that a week earlier than we normally do on November 17th, because we have a holiday coming up soon, believe it or not. Less than 1 month away from Thanksgiving. So we hope to see you on that training. And then also, in case any of you have not heard, we are going to be making some giant business changes. In a nutshell, Simply HR, as we know it, is closing up shop. So Nikki, my business partner, our co-founder, has been doing amazing things with Define the Line. So she is helping so many workplaces minimize and end workplace harassment through her prevention trainings, and that's called Define the Line. You can see how to reach out to her, or you can look at definethelinecomic.com. And I have been presented with an opportunity that I just couldn't turn down. So we do have some resources we would love to connect you with. We have the contact information for Heather there. Heather is with Employers Council. If any of you are familiar with Employers Council, they have a really, really robust program, and they, effective October 1st, have changed their pricing model to make it more accessible to smaller businesses. And they have HR consultants, they have trainings, and they also have employment attorneys, which is a really, really great resource. And I apologize for not putting their contact information up here too, but HRX is another organization that is local. And we think they are a wonderful group of humans too, and they are able to help with HR consulting from now and definitely in 2022. In the meantime, if you have some projects that you would like to knock out before the end of the year, if your handbook needs an update, if you want to talk about some burning HR questions that you have, we definitely want to make sure that you are taken care of as well as possible. So please reach out to us during this next couple of months so that we can get you taken care of and get you set up for success before 2022. We're so stinking grateful for everyone we've met along this journey, and we definitely hope we keep in touch, seriously. So I do have a few minutes here, 10 minutes, in case you want to ask some questions or have me review some of those slides that we went through to hash out specific questions. And as always, we want to thank you very, very much. And I have provided this email address as the email address I will be using in 2022 for any random residual HR questions that may be out there. And thanks for joining. If you want to stay on, that would be great. We can chat about what questions you have. If not, thanks again. We'll talk to you soon. I am going to stop the recording in case that was stopping anyone from asking questions.